What does informed consent for fluvoxamine, otherwise known as Luvox, look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're going to be going over Luvox, otherwise known as fluvoxamine. So this is an SSRI, but there are a few additional unique things to fluvoxamine. So first of all, it acts as a reuptake inhibitor on the SERT receptor, just like all of the other SSRIs, but it also has an additional activity, which is as an agonist for the sigma-1 receptor. What does this mean? It basically can have benefits through multiple different mechanisms. So with the latter, it's actually going to modulate the endoplasmic reticulum response, which is that squiggly part, if you remember, of your cell biology days. And so it's going to prevent something called cytokine storm, which is very inflammatory. And so essentially it has some anti-inflammatory or anti-inflammation properties to it. So it's FDA approved for OCD and anxiety, and we typically think of this as the SSRI to use with OCD. However, given this additional mechanism of action, there is some thought that it could be used for other indications as well. So it seems to have some cognitive benefits, and there's interest in using it for things like long COVID or other brain type injuries. So like an SSRI, it's something you have to take every day. It will take up to a few weeks for you to feel an effect. And it's going to have all of the same potential side effects, things like headache, dizziness, upset stomach, sexual side effects, increased bleeding risk of SI, risk of drowsiness and or insomnia, risk of triggering mania. And fluvoxamine does tend to have more of the sedating side effects of the SSRIs because of its cross-sectional activity on acetylcholine and histamine receptors. Like any SSRI, hyponatremia is also a risk, as well as serotonin syndrome if there are too many serotonergic medications on board. Other things to keep in mind with fluvoxamine is once you're at a dose of 100 or greater, you do have to dose it twice a day. So that can be an issue for some people in terms of compliance. And additionally, it also has a lot of interactions with other medications. And so it's important to check with your provider to make sure that it's safe to take with whatever other medications you're using. And just like any SSRI, I counsel the patient that the longer you take this medication, the more challenging it can be to get off. And if you stop it abruptly, there can be really potentially dangerous adverse effects, things like protracted withdrawal or akathisia. And so if it's determined that we should decrease or discontinue the medication, it should be done with a hyperbolic taper that is at the rate that the person can tolerate. Of course, after we've gone through everything, then I would ask if they had any questions and we would make a shared decision and go from there. If there's another psychiatric medication that you want to hear me go through the informed consent process, then please put it in the comments below. I'm also getting together an email list for those of you who may be interested in my content because I may be having future offerings, resources, classes, things like that. So I want to be able to communicate with you all directly. So if that's you, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.